for this wonderful conference. I'm not going to say too much since the WHO have already updated us. I'll just give you our Congo DRC pandemic statistic updated up to date, and I share with you our experience, how Ebola experience can help us to control this COVID pandemic. I don't know if somebody can put my first slide. Somebody can put my first slide. Okay. Voila. Okay. Next slide, please. Next slide. I'm going to share with you this COVID virus. Like you know, that COVID that can enter in the body, maybe in the lung, so affect the pneumocyte 2 and the pneumocyte 2 specifically. So there's a specific receptor that occur, angiotensin 2 receptor. That's the COVID like to enter. We find that cell with those receptor in the lung, heart, and the kidney, intestine. So next slide, you can see COVID affects 10 times more that receptors. So as COVID is a COVID virus, so it affects the respiratory system, and then it's found more common in the animal and the human, but like we said, is a zoonotic virus. Next slide. Next slide, please. So, as remind us by WHO, COVID virus started by in the Wuhan city in China. So, like they say, the zoonose maybe started by the dry animal they're selling in the market. Next slide, or live animal in the market. That's why they think people buy those dry animal. Maybe it was the first spread of the COVID-19. Next slide. But they're still thinking. Next slide, please. Next slide. Next slide, please. Wow.
Dr. Yassa, do we still have you? I think there's been a connectivity issue.
Yes. Okay. So maybe he has the internet problem, but he might come back. What
Our internet is a...
Okay. You're back.
Okay, can you go to the third slide? The third slide. No, before that. Go ahead. Again. Okay, those are our... Okay. So in Congo, we are, before that slide, please, in Congo, we are organized. We have a note. Next slide, before that slide, please. Before, okay, we're here. So in Congo COVID, we are very organized. So you can see our map, Congo. So we, so far, up to date, we reached 459 cases, and then it means 6% are lost, so 28 deaths, and 50 cases, that means 16% have healed, and 381 are still under monitoring. They are positive, but are still not yet still under monitoring. Next slide. Next slide. As you show, you can see we have less deaths, almost 6%, and then we heal 50 cases, and then 400 cases are still under monitoring. Next slide. Next slide, please. I want to share with you how the distribution is under the province. So let's go move ahead. Before that, please. Somebody before, go back in the provinces, go back. Next slide, next. Go back to the province. After this, next slide. Next.
Dr. Yassa, could you just mention to me what the number? Could you just mention to me what the number of the slide is, and I'll click on that then.
Okay, so we are in the province. So the next slide talking about the provinces. Slide number 13, I think so. Okay, number 12. Number 12, slide number 12. Okay, so in terms of provinces in Congo, you can see all the epidemic for COVID is found in Kinshasa. So why Kinshasa? Because that's the capital area where all the tourists, the business people who are coming from Europe, the big airport is in Kinshasa. So that's why the COVID is found more. And then we found five cases in North Kivu, near Rwanda. All these five cases are healed. And then in the South Kivu, we have 4 cases. These 4 cases, it was a 10-case people in quarantine. Only 4 was confirmed. And all the 4 are healed. So the Ituri, we have 1 case is healed. And the Kwilu, 1 cases. And the Katanga recently, so 1 cases. So we have more the cases in Kinshasa. All the province cases except for Katanga, not yet, and under monitoring. Okay, number 13, next slide. We have taken in Congo. Next slide. Next slide, please. Okay, so in Congo, we just get the framework. We just follow the framework. Next slide. Next. Let's go to the framework we use in Congo. That's the formula I put there. Number 13, number 14. Number 14. Okay, there. So which framework we use in Congo? So what we are trying to do in Congo as a measure in our fighting for the COVID, we're just trying to reduce the reproductivity rates. So as you know, the reproductivity rates equal to transmission efficiency, beta, multiplied by C, the contact, the exposure rate, and by duration of infection. So what do we do? We're trying to reduce the reproductive rate at 1. So if we manage to reduce the contact exposure less than 1 over beta to T, so that's what we are managing. Since we don't have a B, we don't have to work on B, on beta and D. We need to have a treatment. We need to have a vaccine. We don't have. So what we are trying to do is to work on a contact by social distancing, quarantine, washing hand, and mask. So this, I think people are changing their behavior. It's almost the way we fight Ebola. So that's the the formula for reproductive rate. That's why we are working on that. Next slide. So I think we're trying to manage like all these provinces like Kivu. So you see we're using this formula. So we're trying to use wash hands and using the mask and the social distancing. So restriction, we close the school. So we're trying to avoid all the mass people together because that's we can spread more the COVID. So, but we have some challenge in our country. For we don't have enough cases, but how do we end it? So we need to do a testing like a WHO say. But you can see in Congo now, the testing is only in Kinshasa. So the lab for testing to all the provinces, you know, Congo is like a continent. Now they stop all the plane moving. So we are using like the UN plane to send the blood, if there's a plane or not. So all this is to delay. So we have only viral testing lab is in Kinshasa. Problem. But contact tracing, so we are trying. There are so many innovations. Some like here in Bukavu, they are making some program for and a phone contact tracing using the phone, the smartphone. Like CamCare also proposed us to do the same thing. So then for the treatment, like you know, we are just using the protocol using in France with chloroquine. So we are trying to borrow also the Indian and prophylaxis. So people were contact positive before they develop the disease. We give them the program they're using for Indian, but we adapt it. So we did 400 milligram twice for 3 days, and then 1 tablet for 11 days. So we do like trying like to do some study on that to get the evidence-based practice. Okay, we don't have a vaccine, so but the monitoring, we have a monitoring system in place, and preparedness, we have at least so many hospitals in the country. Only 3 hospitals are ready to receive the cases for coronavirus. So we don't have those equipment, respiratory. We have only 50 representatives of the whole country. It will be very difficult for us, but still we're trying to use our experience for the past experience for Ebola. So let me now discuss with you our next slides, our experience of Ebola, how it can help us to reduce our, like the last Ebola outbreak, it was in Beni, in the southern, northern part of Congo. So it was in Beni, Butembo, Kenya, and Goma. So that's why it's a case. But we managed to end it. Normally, in last month, we were supposed to declare end of Ebola, but 1 case raises. So that's why we delay a bit. We're doing a contact tracing to find where this case comes from. Next slide. So our first experience that helped us to end up Ebola, it was research. So during that outbreak, research was doing there. So we're doing a treatment research, that's real work. We're doing a vaccine, so proven the vaccine, it was working, and then some treatment was used. 2 molecular using, that's work. Our next slide. Next. And then the second one, there was a testing, like WHO say, test, and treat. So you see, we, like now, the test is found only in Kinshasa, and the PCR test. We don't have any rapid test. So all the provinces, we don't have a test. So you see, but in Ebola, we have a test, a rapid test, the point of care, a gene expert test. So you see, it was a DNA test. So it was very quickly, and then we detect fastly, we put in treatment, we quarantine everyone, we test them, we put them in treatment. So it was a good experience. That's what we can borrow them for the COVID. Next slide. Next slide. So Again, we use a vaccine. So you can see even the health workers. Health workers, they are not being protected. For Ebola, a lot of health workers was dying, the doctors, because of no protection. But now, for Ebola, all the health workers were vaccinated. So they was protected. And all the equipment, the PPE, it was there. So you can see the vaccine also help. So even the population. So that's the example. Even if people don't like vaccine, but the vaccine is very, very important. That's the only one that's helped to end Ebola quickly in Congo. Next slide. Next. Another experience for us Ebola was a treatment. Two molecular for treatment was used. The MAB114 and Reagan it was used. And 90% of patients was receive that treatment, their viral load become very even undetectable. So you can see all this was also experienced. So research is very important on this particular COVID-19, but we need to sensitize people the importance of research. But Congo is the example of this pandemic Ebola. It was ended through research regarding the new treatment they're using, and it worked at 90%. It reduced the viral load. Next slide. Next will be the end. Okay. Also, the survival supported. So people who survived from Ebola was like a testimony. There was also like using their part to sensitize other people. So it was very positive. Next slide. Next slide. Okay, and the community engagement, social science, the community engagement is a very, very, very role player on that fighting for Ebola. So all the community were engaged on this fight. Even a COVID, I can see even here, some people don't believe on COVID. So you see, there's not really sensitization of the population. So we need to sensitize them, borrow for that example for Ebola. I think it will help. Next slide, I'll give you some example for picture from Ebola and the COVID as the last part, it was my question, the funding mechanism. The funding mechanism was we really have a funding. So the money was put in place, contributed to really end quickly that Ebola issue. So let me share with you some pictures where I can end my presentation for our Ebola. There's like a similarity with COVID, but Ebola, we can view that's exanthema avec necrotic and bullets. You can see that's bullet is Ebola. So that's very common for Ebola. Next slide. You can see COVID also have a fourth inflammatory process. So that can release so a lot of histamine and the cytokine that can lead to vasodilation, can also type 1 allergic reaction, can be dermatitis. So you can see how this similarity you can find also in Ebola. And even so those lesions, it can maybe confusing between Ebola and then even Ebola is hemorrhagic, but in the beginning, you can confuse it with COVID. Next slide. Those are the pictures I've chosen for you. So I think we need to work together. Like you develop that program, Asia and Africa. I think we need to share our knowledge and share our knowledge like Professor Ira. We're sharing knowledge. We're trying to make our mask for our population. There's money to buy the mask for N95. We're trying to do it at home. We borrow India system, and then like we now borrowing now the Indian prophylactic drug for preventing people COVID positive, like the health workers who are in contact. So we put them in a treatment. I even see in America they are using the same Indian prophylaxis system to do their trial. So for prophylaxis for COVID. I saw it in a presentation in the US, in University of Washington. So they are trying to get 2,000 people on this trial. So thank you very much. Is there any question? I think sorry for the internet connectivity.